Going? Okay. All right, everybody. Hey, Dr. Nelson asked if I would say a few words regarding the new Protec machine that I've had in my office for about a month now. So first off, Dr. Jensen from St. George, Utah. Been practicing about 10 years. Got a good practice built up. I got a partner in here with me, and we're doing pretty well. We average, 30 to 50 patients a day. So a pretty good clinic that we've had going a long time. So I guess I wanted to talk about, I'm a pretty straightforward guy, so I'll just kind of say it how it is. A month ago, I was down at the Pro Sports seminar, which I ran into Dr. Nelson. I've ran into him many times, so I know him very well. But anyway, where I got introduced to the Protec machine. With most of you, been practicing long enough to where we run into a few different situations. Most people respond to adjustments. You start hitting the age of 45 plus where people get a little bit stiffer. They maybe don't adjust as well. Maybe you don't get the responses that you want, the outcomes that you want. And sometimes we resort to therapies. If it's disc presentation, sometimes it's decompression, disc work, muscular therapies, ultrasound, different rehab, stuff like that. But sometimes we find we don't really get the results we want with those either, and we're hoping with time using those that they work. So after 10 years, you kind of run into the wall. What do you do with those patients that either you can't adjust, the patients that don't respond well, the patients that even adjust and they don't respond well, or the people that don't want to be adjusted? No matter what the condition, neck or back. So when I ran into this machine, like I said, I've been practicing long enough to where there's got to be something else. There's got to be another treatment option. When I ran into the Protec machine, it was the answer. Once you kind of get the vision when you first look at the machine, and let's go over and let's go in this room. So the Protec machine is here. Let me turn this fan off. We put it in here. So the machine, when you see it initially, is kind of like, wow, what is this? But when you get seen or you get put on or you're watching someone get put on it, where they sit and get strapped in, you can put the low back in decompression. You can put the neck in decompression. So no matter what you're dealing with, there's options. The idea is that you can unload the spine, mobilize the spine. If you're dealing with low back, you can get into hamstrings, which usually 20-25% contribution to low back pain. The point is outcome-wise, you can get way better outcomes with whatever you've been doing, okay, especially if they're not responding. So the biggest thing how this has impacted my practice is it gives us another option between therapies that aren't responding, people that can't adjust, and it gives us that option to just mobilize the spine, coupled with whatever exercise, and we get great results from it. Okay, we've had it for a month. I have multiple patients that don't respond, especially that 50, 65 range. And within a month, actually like 2 or 3 weeks of treatment, a few times a week just on this, we get great results. So it's impacted my practice by pretty much 80% of my patients get on it. Even if they adjust well, you find that with this and mobilizing their low back and moving their spine, they get way better outcomes. They feel better leaving here. And that's what's going to set you apart from everyone else. You do something different, you get better results. I just don't want to miss a point here. So yeah, we use this multiple times a day. Probably at least 20 people a day are getting on this. So immediately, even after I got this machine, on a Saturday, the very next Monday, we were rocking and rolling with it. And we've been learning the protocols and going through, and you learn pretty quick because you use it on everybody. So patient volume, it's not just even having that option. Patients, you have them putting them on this, you have them returning for just this. Seeing you as a doctor and adjustments are awesome, but you'll get return visits. Your return visits will go up dramatically with this because people see the effects, they feel the outcomes leaving, and they feel it immediately. So even return patient visits are awesome and great. They've affected it big time in the month we've had it. The plans for the future for us are to get a few of these machines, even get into pain management with injections and those types of treatments where injecting the spine and coming and moving the spine even increases the efficiency of those treatments. So I think we've hit pretty much every one of this, but I've had it a month. I've loved it. It's allowed me to treat pretty much everybody, especially the ones that I can't adjust or I don't get the outcomes I want. I've been happy with the device. It's been a great find. It gets me excited about treating the next 20, 30 years that I hope I can still practice. But I hope this helps. I'm definitely an advocate of it. I hope that it can do the same thing in your practice when you start to see the vision of how it can help patients, allow you to see more patients, but also keep people moving and performing well in prevention. So anyway, again, Dr. Jensen, and I hope this helps some of you that might be deciding if this is something you want in your practice. So anyway, we'll see you and have a good day.